The Centers for Medicare and Medicaid Services releases their latest negotiated drug pricing list. Health leaders pose questions regarding a new FDA review program. And consensus has yet to be announced on a Republican plan to address impending insurance premium spikes. For the week of December 1st, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Of reporting on this from yourself as well, Jake, over the last few days. I will tell you that healthcare is a topic of discussion that's happening very frequently and robustly inside the West Wing right now. The president's very much involved in these talks, and he's very focused on unveiling a healthcare proposal that will fix the system and will bring down costs for consumers. As for the details of those discussions, I'll let the president speak for himself. As you all know, sometimes you report things and then President Trump comes out with an announcement, and those things are not always true from what you hear from sources inside the building. So I'll let the president.
Kicking off this week's episode with news from Capitol Hill, where lawmakers are returning from Thanksgiving recess without a plan to address the spike in health insurance premiums that's expected if the Affordable Care Act's enhanced advanced premium tax credits expire at the end of this year. President Donald Trump had been expected to unveil a proposal last week that would have extended the enhanced subsidies for 2 years, while imposing new income limits, require every enrollee to pay at least a nominal monthly premium, and called on Congress to appropriate funding for cost-sharing reductions. It also included an option for enrollees to receive part of their tax credit in a tax-advantaged savings account. However, the announcement was canceled at the last minute, reportedly because of GOP opposition to the plan. Republicans on Capitol Hill remain divided over a path forward on healthcare costs. Some GOP members support allowing the subsidies to lapse, while others are weighing the introduction of their own healthcare reform legislation. Senate Health, Education, Labor, and Pensions or HELP Committee Chairman Bill Cassidy, a Republican physician from Louisiana, for example, has proposed funding for certain enrollees in the Affordable Care Act marketplace, while Representatives Jen Kiggans, a Republican from Virginia, and Josh Gottheimer, a Democrat from New Jersey, are leading a bipartisan effort to extend the subsidies while imposing a new income cap. Senate Majority Leader John Thune has agreed to hold a vote on an extension no later than the second week of December. House Speaker Mike Johnson has declined to commit on such a vote in his chamber and has reportedly indicated that there is little interest amongst his caucus to extend the subsidies. Absent congressional action, premiums on the Affordable Care Act market are projected to increase 114% on average next year. Congress is scheduled to be in session for just 3 more weeks during the remainder of 2025. Senate Help Committee Ranking Member Bernie Sanders, an independent from Vermont who caucuses with Senate Democrats, and House Energy and Commerce Committee Ranking Member Frank Pallone, a Democrat from New Jersey, have written to the Food and Drug Administration regarding the recently announced Commissioner's National Priority Voucher Pilot Program. The pilot program, which aims to accelerate approvals for companies aligned with the United States' national health priorities, has promised to reduce certain drug and biological product application or efficacy supplement review times from 10 to 12 months to just 1 to 2 months. The letter reads, quote, "We have significant concerns that this program will enable corruption by creating a new, lucrative gift for drug makers and allies politically favored by President Trump." The letter goes on to say, quote, "This program could undermine public confidence in FDA's decisions and raise safety concerns, including rushed reviews by an agency whose staff have been decimated by this administration's cuts," unquote. They pose a series of questions about the program and request a response from Commissioner Marty McCary no later than December 11th.
And Wegovy, often called Ozempic. This is a triumph for American patients that will save lives and improve the health of millions and millions of Americans. Amazing thing. They are amazing.
Final news today, where the Centers for Medicare and Medicaid Services has announced the agreed-upon prices for the 15 drugs under the second round of the Medicare Drug Price Negotiation Program. The administration estimates these prices, which will take effect starting in 2027, will result in $12 billion in federal savings. The selected drugs accounted for about $42.5 billion in total gross covered prescription drug costs under Medicare Part D, or about 15%, in 2024, and were used by approximately 5.3 million people with Medicare Part D coverage. Among the 15 drugs included are the weight management drugs Ozempic, Rybelsus, and Wegovy.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, December 2nd at 10 a.m., the House Ways and Means Subcommittee on Oversight holds the hearing Lives at Stake, holding tax-exempt organ procurement organizations accountable. Second, on Wednesday, December 3rd at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee hosts a hearing titled Making Healthcare Affordable Again, Healing a Broken System. Third, on Wednesday, December 3rd at 10:15 a.m., the House Veterans Affairs Committee holds a legislative hearing on the Sherry Briley and Eric Edmondson Veterans Benefits Expansion Act and the Guard Veterans Healthcare Act. Fourth, on Wednesday, December 3rd at 4 p.m., the Senate Veterans Affairs Committee gavels in a hearing to examine medication management in VA healthcare. And last, on Thursday, December 11th at 10 a.m., the Senate Help Committee convenes a hearing entitled Examining the Future of the U.S. Organ Procurement and Transplantation Network. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.